The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live, actually Ageless Health with yours truly, Dr. Tom. And I got a great show for you today, one that kind of goes through the weeds a little bit because we don't think about really what happens. You know, you've heard me talk about the chemical side of what happens to our bodies, right? Everything that's outside of our body, we call it exogenous, things outside that affect us inside. And you've heard me say things that you eat, you shouldn't eat, things that you need more of, you don't get enough of. Well, we're going to get down to very specific situations. We're going to talk about your bad back. You know, that pain that's always there, it comes and goes. We said that it's the number one condition that affects most people at some point throughout their life. Up to about close to 90% of you will have back pain at some point. The bottom line comes why. You know, you may not be overweight. Some of you are. You may not be in a very, very vigorous lifestyle. Some of you are. But there's more to it than that. And I want you to understand, number one, what can trigger this problem, but more importantly, what you can do about it to make a difference. So here's the deal. Let's get into it a little bit at a time. So anytime that you cause an inflammatory reaction, inflammation, when I hear the word inflammation, I want you to think acid. Acid burns, acid deteriorates, acid breaks things down. And that's what it does to your body. So if you eat foods that are highly acidic, your body's going to break down and tissue's not going to be able to repair the way it's supposed to repair itself. So from your mouth to the other end, right, you have this long food tube, goes all the way through. One's for digestion, the other one's for elimination, but it's all tied together. But as soon as you put something in your mouth and you start tasting, you start chewing, the nervous system, your brain, your spinal cord, the nerves, they go out and they go to the different parts of your body, start saying, oh, got something coming in. Let's see what we need to do about it. So here's the deal. You know, you've heard me talk about different things that you shouldn't touch, right? My mantra: avoid sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products, and it goes on. So if that's the case, if we do a self-check, how much of that really goes into our body, and what the heck does that have to do with my low back? Actually, your back all the way through, but we're going to talk about that low back and the pain that radiates into your hips, because that's the topic of a program that we have coming up at the Roselle Center for Healing just in a couple of weeks. In February, Dr. Harlan Browning, the professor, and I will be presenting with you. Please join us. If you got a back pain that doesn't go away, if you got a problem that is just sitting there and you've done everything, you've taken all kinds of drugs, you've had injections, you've had stuff, but you have pain down the leg pattern, remember at 6 p.m. on February the 18th, it's a Wednesday night, the weather's going to start being a whole lot better than it is today. If you're in the Washington area, please join us, because I want you to get out of pain. I don't want you to be in pain. I want you to have a life. I want you to enjoy yourself. I want you to be able to do the things that you want to do. So mark it down, February 18th, 6 p.m., Roselle Center for Healing in Fairfax. Join us, and I promise you, the professor and I will get into the intimacy, but more importantly, you're going to leave with things that you can do. And as of today's program, you're going to have things that you can apply right now and get it done. So let's jump into it a little further. We're talking about your low back pain and why it doesn't go away, and why it may be directly related to some stuff that you put in your mouth. So when you eat things that are inflammatory, they cause inflammation. Inflammation is acidic. Inflammation also swells. Inflammation also causes tissue to kind of like a fibrous tear. You're going like this. So if that's the case, why didn't your doc tell you that? Well, because they look at, take this for that type of situation. You got this, take this muscle relaxer. You got this, take this painkiller. You have this, take this down regulator. It's like Cymbalta. They use that for global body fibromyalgia without answering the question why it's there. I can tell you why it's there. Come and see me. We'll talk about that. But here's the deal. Let's get into your low back, right? So you have this food tube that I talked about, right? So we said avoid certain things. We talked about that as well. So what are the foods that are out there that can make your bad back, but more importantly, why does this take place? So let's talk about that a little bit. The connection between diet and low back pain, right? So a lot of studies that have been going on for years, some of them have been set aside and ignored, but it indicates that diet, meaning stuff you put in your mouth, and diet means, the coffee you drink, the sodas that you put in your body, the sugars, the in-between stuff that you do, the lack of putting the right things in. The diet can influence your back pain, especially through the effects of what we just talked about, cause inflammation. So a diet that is high in inflammatory foods dramatically can make things much worse, but it can also trigger problems that you normally wouldn't suspect that they could trigger. So you maintain a diet that is rich in certain nutrients. It's crucial for spinal health. If you go to a doc, and even a structural guy like me, or people that do functional integrated medicine like me, you need to ask the question, are we just treating the structure, or are we dropping the inflammatory levels down so we can heal? So the question becomes, what can you do? And I'm going to give you those things right now, a lot of them, to make sure that you're doing the things that you're supposed to be doing. So if you're getting treated for back pain and they haven't addressed the nutrient bases, they haven't addressed the vitamins, they haven't addressed the inflammation. If you have a gut, an intestinal tract that is irritated, first of all, if you took in the intestinal system and you cut it transversely like this, you would see all these little fine hair follicles that come up through it. These little projections increase the absorption level of your gut. But if you're eating things you shouldn't eat, pretty soon they get beat up. And now you just have this flat layer that becomes hard, very much, and I'm going to use a metaphor like phyllo dough, the pastry they put around Greek stuff, right? Phyllo dough. And it cracks and it fissures and it's irritated, and food gets into your system that is not properly digested. And it causes what we just talked about, causes inflammation. If your stomach and your pancreas are not producing the levels of digestive enzymes that you need, then that's going to cause a problem too, because now you have these foods that are not being broken down, and they come in and they become allergic to your body because your body can't deal with the hard coverings that are there. That I'm using metaphorical relationships so you can understand it a little bit better. So if you can't digest things, if you can't break it down because your gut's not good, you're in trouble. What happens if your microbiome, all the good bacteria that's in your intestinal tract that's supposed to protect you, that's supposed to, give you that immunological resistance, isn't where it's supposed to be? Well, here's the deal. You need that to be the guardians, the picadors, if you will, meaning you've ever seen a bullfight, these guys, the picadors, they have the picks, they weaken the bull. That's what your microbiome often is there for, is to weaken, break down these otherwise pro-inflammatory things that you're putting into your system. Now, if we said, well, doc, what should I eat? Well, how many of you on a day-to-day basis get things like, every day, you trade off the different proteins, good ones, clean, grass-fed, free-range, but you add things like nuts and seeds and fatty fish and berries because they're very high in polyphenols, and leafy greens like spinach and kale and collards and endive and so forth. They're very high in calcium and magnesium, and they keep your bone structure in a good situation. Okay, so we're just touching the surface, but on the 18th, we're really going to get into this. Now, how about food to avoid? What should you be avoiding? Well, I just gave you a mantra, but here, if you did nothing else but get rid of the processed foods in your body. We're going to talk about that a little bit more as the program goes on. Alcohol is one of the most inflammatory things that you can put into your system. So if you're always drinking something, even if it's a drink a day, but it's ongoing, and you don't give yourself any kind of break for your body to heal up, that can negatively impact your overall health, let alone your back, but it will. So what am I drawing a conclusion to? I'm simply saying to you is that if you begin to really look at your dietary patterns and look at the foods that are anti-inflammatory, avoid the things that are inflammatory, you're going to have a significant impact on your pain threshold. Those of you who've been diagnosed with rheumatoid arthritis, that's why you hurt, right? That's why your back hurts. That's why your joints hurt and so forth. I can guarantee you that your intestinal tract and your liver are not working the way it's supposed to. And it usually is triggered because you got a history over the period of years of putting the wrong things in your body. Am I making you a little uncomfortable right now? So, oh my God, I can't eat my salami and my capicola and my, all the stuff that I come from and, an Italian background. That's got preservatives in there, my friends. And guess what? It's going to preserve you. How about those of you who love your pork? You like pork, right? And you come to see me and I say, eat no pork ever. And you look at me and you say, I don't like you anymore, Dr. Roselle. And I'll say, listen, here's the deal. Pork is the food that is basically one chromosome difference than who you are as a human being. So the immune reactions are much more likely to occur over time by eating pork. That's number one. Number two, pork that is that is lot raised, with other pigs all over the place. What do? They dump their feces, their fecal matter, where they stand, basically. And then what do? They put these, these big feeding troughs there in the middle of all of that. So now you've got what? You've got parasites. And what they do is they put a nitrate type of product in it to stop the parasite from fulminating, but they don't get them all. So the little cysts, the eggs that make up the parasitic pattern, they go into you. And then pretty soon, it's not a matter of if, it's a matter of when. And these things fulminate. How about those of you like sushi, right? Raw fish. Again, that's another one of those things that it's not a matter of if you're going to get a parasite, it's how long before it bothers you. And that all by itself can cause your intestinal tract to be a mess and subsequently your back to be on fire constantly. I know a lot of you say, but I love my raw fish. Well, guess what? You and parasites will have a really long life together and other things will take place as well. But you've got to avoid anything that has sugar in it, particularly fructose. And, we're going back to this diet thing and you're saying, oh my God, Dr. Tom, you can't tell me I can't have this stuff. Well, how about putting something in front of you like this amazing, beautiful, high energetic person that has a clear head and no pain in their body? Would you like to live like that? I don't know about you, but I'm trying to make it even better as time goes on for me. So here's the situation. Please listen to what I'm saying. And then after you get it, after, we put all this together, then you can decide. And if you decide to not follow through, well, that's on you, my friends. That's the way it is. So yes, your bowels, your intestinal tract can absolutely cause back pain due to various types of mechanisms. We're going to talk about those just for a second now. And they're including back pain. Okay, the back pain, what happens? It's a referred pain. It's from the intestinal system to your back. Why? Because you have nerves that come from your back that go to the small intestine, that go to the stomach, that go to the pancreas, go to the large intestine. And if those guys are all beat up and irritated because you're putting junk in it, garbage, if you will, then your back is not going to work the way it's supposed to. Then the little bones, they're called vertebrae, right? What they do is they go into a reactive pattern. The vertebrae go out of position just a little bit, just millimetric, and they cause either a stretch or pressure on the nerve root or the cord, and now the signaling becomes bad. So we have the referred pain from the gut. We have an inflammatory reaction. It can be irritable bowel syndrome. It can be irritable bowel disease. It can be a colitis problem. It could be hemorrhoids, by the way, which make your back really hurt bad. And so what does it have to do with what I eat? Lots, because you're causing inflammation. You're causing these blood vessels to have weakness in them, and they're going to pop out. By the way, hemorrhoids have a lot to do with the liver. There's a little trunk that comes off the liver. It's called the hepatic branch or hepatic arch, and there's two arteries that come off of it. One is called the mesenteric artery. It controls this apron in front of your intestinal tract. And the other one is what? The other one is the hemorrhoidal artery, and that goes down, and you know where that goes, right? So if the liver is congested because of all the garbage you've been putting in your system, then that artery is going to be swollen, and you're going to have lower back pain. You're going to have pelvic pain. You're going to have rectal pain. So listen up, my friends, right? How about muscle stiffness and tension? So discomfort in your gut, in your intestinal tract, right, has to do a lot with muscle tension in the back as a protective mechanism. So if your gut is tight, remember it's muscle as well, it's smooth muscle most often, and it's going to refer back to the back. It's going to cause your back to go into spasm. And one of the things that may be missing is magnesium and calcium. in the proper ratios. Now, if you have that type of balance, it should be 1-to-1. If you know your calcium's low, you got to have some magnesium to transport. You got to have some vitamin D to transport it. So all of these things have to go hand in glove for your body to work the way it's supposed to. Now, there are other conditions, that we can look at. We mentioned just a few, and colitis is not a fun thing, particularly if it's ulcerative colitis. That means you're bleeding. If you have hemorrhoidal problems, it can be major. You can have fissures. There are little tears in the intestinal lining, particularly at the rectal area. But that has to do with what you're eating and what you put in your body. We talk about diverticulosis. Those are inflammatory reactions and infections in these outer outpocketing areas of the large colon. And it can give you tremendous amount of back pain. But here's what happens. That reflexive inflammatory reaction due to the stuff that you're shoving in your body that shouldn't be there ultimately affects, as we said, the structure permanently, because now you see shrinkage of the disc and you see irritation. So here's another piece of the puzzle. How many of you think water is for washing and not drinking? You say, what? Yes. So there's a lot of people that don't get a lot. I drink water. Well, how much? I get a couple cups a day. Really? Couple cups or couple cups? Here's the situation. You need water to flush the intestinal contents. A lot of you are constipated and don't move your bowels well because you're dehydrated. How many of you this time of the year, we're in the winter season in the Washington metropolitan area, and how many of you don't drink a lot of water and you find that your skin is dry and it itches and it burns and you're looking for creams to do it? You know what can fix it? Just water. But here's the deal. If that's an indication, I can guarantee you that your joints are going to be stiff. Your joints are going to be tight. Your pain patterns in your body is going to be worse. Why? Because they need water too. Your spinal disc, the cushion between two bones, is what? 75% water. It's cartilage, water, and it's different between the inside and the outside. So if you're not getting enough water, something that can easily correct, put a little salt in it. We're talking about Baja Gold. We're talking about a little bit of Himalayan pink salt. We're talking about things like, stay away from sea salt because you don't know where it's coming from. But start with that Celtic salt, Baja Gold, Himalayan pink salt, and so forth. And how much? About a third of a teaspoon a day. I promise you it will not increase your blood pressure, but that water will get into the system. It will clear your gut and so forth. How about, we talked a little bit about your good bacteria. How many of you are getting a good probiotic on a regular basis? I don't know about you, but if you don't do that, your intestinal system is not going to work and protect you, and it's going to cause inflammatory reaction, and your arthritis is going to go through the ceiling, and you're going to wonder why everything is so stiff, but your back accordingly. All of a sudden, you can't bend over anymore because there's no flexibility in that spinal disc. We're going to get into more and more as we go through the program today, but we've already talked about a whole bunch of things. We talked about avoiding things that are inflammatory. Inflammatory foods will cause your back to be worse. Okay, period, end of story. If you're not getting a lot of good vegetable sources and clean proteins, and you're eating raw meats and so forth, you're destined to have back pain. I don't care, when it happens, but when it happens, my friends, it's going to be bad news for you. So listen, it's easy. You can be proactive on this. You can clean it up. How many of you sit all day long and you sit over there, you grab your cup of coffee, you grab a little candy bar or something because you don't want to get up. You reach over, you got a bag of chips and you're pulling them out, and there's nothing but, seed salts, or seed oils in it. You're causing your inflammatory level to go through the ceiling. Why are you doing that? Why are you doing that? Get rid of the pro-inflammatory foods. Start drinking a lot of water. Look to see if you're getting enough minerals in your diet. As we go through the program today, I'm going to add more and more pieces to the puzzle. We're going to talk about foods you should be eating. We're going to tell you, how to avoid certain things, what to eat and when to eat them. If you did nothing more than that, I promise you, your back pain will modify itself. We're going to talk about the different types of calcium that is necessary for that. We're going to talk about, the magnesium and which one you should be using and so forth. So don't go away. Continue to listen. You're listening to Ageless Health with yours truly, Dr. Tom Roselle Live. And I am the irritation to the medical profession because I want you to have a life. Don't go away. I'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey everybody, welcome back. You're listening to Ageless Health with yours truly, Dr. Tom. And we've got a great program today because I'm going to show you how to get out of your back pain. So many of you are causing it yourself, right? So if you are, why don't you get rid of it yourself? Why go into a place where you're taking drugs the rest of your life? Don't you want to get your body back? Don't you want to have some energy back? You know, I'm watching people that walk into our practice and they're overweight. And one of the first things that we do is we do a dietary history on you. Yes, I make you write down everything that you put between those two lips of yours, and no matter what they are. And I said everything, including how much water you drank, the medications you're taking, the vitamins you might be taking, and where they're coming from, where you got them, and all the foods and quantities and so forth. And people look at me like, oh my God, this is worse than, putting a lie detector on. Now, I care only for one reason, because it's affecting your health. I have a lifestyle that allows me to do virtually anything that I want to. And I can do what I do now, and hopefully I can continue to do it for another, 3 decades or so. Who knows? But the point of it is I'm going to keep working towards it. I keep tweaking it. I want you to do the same thing. So let's get into the program. We talked about some of the things that are not doing well. But if you stick with me to the end of the program today, I'm going to talk about a very special water and how it's made, or how you can make it. Either way, you're going to find out what I'm talking about in a second, meaning at the end of the program, and what it can do to drop dramatically your inflammatory reaction. Yeah, there is actually one out there, and we're hooked up with a company that can provide it for you. All right, so let's get back into the program. Let's talk a little bit more about, different things that are causing the problem. So, we got into the inflammatory pattern. We talked a little bit about referred back pain, coming from the gut to the back and from the back to the gut. So you can have a bowel problem, irritable bowel syndrome, ulcerative colitis, and so forth, that can come specifically from your neurological system. Usually an injury that took place over time, or a postural injury that took place. You don't move, you don't get up, you sit there, and then that goes into bad habits like we just talked about a minute ago, where you're reaching over and you're getting that can of soda, you're reaching over to get that candy bar, you're reaching over and get that bag of chips because you got some hunger, but you're too lazy to get up and get yourself pre-planned so you have something that's nutritional for you. The worst thing that ever happened, in my opinion, in this country is telecommuting, right? So you can sit there at the computer and never get up, sit there all day long. You're locked in. Your dopamine is being influenced because it's a constant stimulation. So you have no motivation to do anything else. Did you know that takes place? That's really what takes place. So remember even something like endometriosis. Ladies, those are the little small tumors that can affect your organs of reproduction. They can actually get into the intestinal tract. They can actually get into other soft tissue. It's a condition that can affect the bowel and lead to abdominal and back pain at a very serious level. And it's often due to high levels of inflammatory reactions and the pressure that this causes on the system, but it also is a hormonal imbalance. It's a progesterone, estrogen inadequacy. Now, the thing that you have to remember, ladies, if you're still menstrual, if you're getting into that menstrual age and so forth, if you've got these endometrial tissue, when you have a menses, they have one too. Did you hear me? When you have a menses, they have one too. So when these endometrial tissue are there, they're affected. And where does it affect? It affects your back, but it'll affect everything else too. It'll give you headaches. It'll give you joint pain. It hurts like crazy. So we talked about some very specific things. We're talking about referral pain. We're talking about inflammatory syndromes. We're talking about muscle tension and contraction, right? That just doesn't let up. You're stiff. You can't bend. It just hurts. It's this dull, nagging pain. So when the digestive system is being stressed because it can't digest food, you have bloating, you have constipation, the body's responds with muscle tightness, specifically in your low back. So think about that for a second. If that's the case, is it a time to fix something? Because those disc spaces, those little shock absorbers in between the bones of your back, they're beginning to degenerate. And now you've got spinal stenosis, that narrowing of the canal where the nerve exits your spine. It's crushing that nerve. Now you have to get some treatment as well as fix the inflammatory response. Your body will fix itself as long as you're still breathing. Did you hear me? As long as you're still breathing, your body will fix itself, but you got to do the things that are necessary to get it done. But why wait until it goes to a place where you got so much garbage, so much degeneration? I don't know about you, but let's do some preventive here. Let's not wait till it's broken and it can't move anymore. It's the same thing with a car. You don't go get the balance in the wheels. You don't go get the oil change. You put in sloppy gas. You do all kinds of silliness. And pretty soon, guess what happens? That car ain't moving anymore. And now you got a major rebuild. So your body's the same, actually even much more significant than that. Why wait until you get a major rebuild? Why? Why wait? So if that's the case, are you going to wait till you get, endometriosis? Are you going to wait till all of a sudden that tissue breaks down even further? You got cancer, and that back pain is a reflection of cancer. Are you going to wait until that spinal stenosis is so bad that you can't even go upstairs because it hurts to go up? Your legs are killing you, and then pretty soon your knees are breaking down. All of that starts in the back and from the intestinal tract. It goes back and forth. It talks to each other. Guys, listen, my friends. Your health is a do-it-yourself program. You are where you are at this moment in time because of the decisions that you either haven't made that you need to make, or the ones that you've made that are sucking you down the hole. Look, here's the deal. You can fix virtually anything, but you have to be proactive. It's not a do it to you from somebody else. It's you taking the opportunity to understand that you had your fingers in the pot and you've been swirling around now for a long time. So why not change it? Why not make a difference? I try to do it every day. I just started doing a program on, I was fascinated by some online Tai Chi, right? Tai Chi. And I used to do Tai Chi in martial arts and things like that years ago when I was, young, dumb, and crazy, and doing all kinds of combative stuff. And so when I said, hey, I wonder, I haven't done it in a while. I still work out. I still, do some core training and so forth. So I sat there and I was watching this video, and I got up and I started doing, different types of things. And I did it like for about 2 weeks. All of a sudden I was noticing I'm getting, wow, a little stiff. Why is that? What am I doing? And I noticed that's what it is. I was using muscles that I hadn't used before, or hadn't used in years and years and years. But listen, here's the deal. You can fix anything. Coming up on the 18th, right? February 18th at 6 p.m. at the Roselle Center for Healing in Fairfax. The professor and I are going to get into this very in depth. We're going to give you tools. We're going to show you how to fix it. We're going to show you what can be done. If you're in that place, you've let it go too far, we'll tell you what else you can do to make a difference. So join us. Go to rosellecare.com or drtomroselle.com and sign up. Listen, as always, these are our gift to you. The only thing we ask from you is that if you do sign up and you can't make it, right? Give us a call. Get on the phone. Say, hey, something came up. Please do it the day before, because we usually have a waiting list and we try to make people comfortable so everybody's not on top of each other in that place. Those of you who've been here, we can get pretty stacked. So please make it happen. We can usually fit 50 people comfortably, 55 people, 3 screens showing all kinds of presentations and so forth. But you got to call, you got to register so we know you're there. Otherwise, you could be sitting by the elevator trying to listen inside. So join us on the 18th, 6 p.m. Love to have you as our guest. We're going to be talking about causes and treatment of back and leg pain. That neuropathy that goes into your feet, that numbness goes into your legs, that tingling that you can't stand anymore, the burning sensation, things like that. They can affect your back. But guess where they might be coming from? They might be coming from the inside of you. We're going to the spine and so forth. But there's a lot of causes, from trauma to stress patterns, usually a combination. Listen, anything that I talk about, if I ever recommend a product, it's going to be on our Ageless Health store. So if you want to check things out, you can do it a couple of different ways. Go to drtomroselle.com and go to the top. It says Ageless Health Store. Click it out. And I told you, if you stick with me to the end of the program, I'm going to tell you about how to make the water that will really help you. Right? AgelessHealthStore.com. It's the easy way to get there. AgelessHealthStore.com. And by the way, if you go to Ageless Health Store, I don't know, I should still have some copies of at least the audio version of my book, Ageless Health. Health is a do-it-yourself program. Check that out. And you should all have a copy of that. And hopefully within the next few months, I was going to say next year, but we're in next year already, 2026. Probably by September at the latest, I'll have another edition coming out that'll be a sequel to this, but you got to have the first one too. So you can get it online, or you can, don't just wait for the next one to come out, because you need this one to understand the next one. Let's get back into the program. Let's talk about why you got back pain, and why that might be is your food, the garbage that you put in your system. So if I want to fix it, what should I be fixing it with? What should I put in my gut that will actually be anti-inflammatory, decrease the garbage that you've created inside your system that's destroying your microbiome, that's eating up your intestinal tract, that's causing your joint spaces to shrink down and make you miserable? Okay? We already established that you don't drink water, so let's get that in your system. So how about things like high levels of omega-3 fatty acids? Where do they come from? Well, fatty fish, salmon, as long as it's from the cold areas. In my house, the only salmon that we touch it comes from the Norwegian area, way up north, because anything other than that is farm raised and it's not good for you. So you want to get wild caught fish, mackerel, sardines. Those are the 3 top foods that are rich, or fish that are rich in omega-3 fatty acids. And they dramatically help drop the inflammatory reaction down and ease the pain. But you got to eat it at least twice a week, preferably even more than that. And then, we talked about what? We talked about vegetables, because everybody said, Doc, why do I have to take a ton of vitamins? Well, if you're really careful and you get organic, leafy greens, spinach and the kale and endive and Swiss chard and so forth, they're packed with high levels of anti-inflammatory, antioxidants, and high levels of magnesium. But you got to eat enough of them. You can't just have a little bitty, like a quarter cup. You got to have some of this stuff about three times a day. one of the things that you can do, everybody asks me about, not eating for periods of time, right? And when you're starting something like this, I would do this. I would suggest do a dietary fast for 12 hours, no more than that to start with. There's reasons to go longer, but that's generally when you're trying to detox, not when you're trying to build up. But 12 hours, it drops the inflammatory level down just a little bit. And then if you're eating good things and they're packed with these antioxidants and foods that are rich, and particularly with magnesium, these nutrients are essential. The leafy greens, the spinach, the kale, the endive, the escarole, and so forth, they're essential for maintaining spinal health and discogenic health and ligament health and so forth. Berries, blueberries, strawberries, raspberries, blackberries, they contain high levels of something called polyphenols and certain types of vitamins that are highly anti-inflammatory. If you add these fruits, get rid of the rest of the fruit for right now. If you got back pain, get rid of them because the sugar in them is too much. Use the berries, blueberries, strawberries, but organic. And you can have a half a cup of them a day. Yeah, once a day. And if you can't, do it once a day, so then have a quarter cup twice a day, maybe a third of a cup, right? But look, here's the deal. They're high levels in anti-inflammatories. They have high levels of vitamins, and they can really add tremendous benefit. Everybody's heard about turmeric. Turmeric is one of the spices. It contains a substance called curcumin, and it's an unbelievably powerful anti-inflammatory. Now, there's some people that are sensitive to it, and just like any other food. So go slow with it, see if it helps you. And then when you get into nuts, don't do it in nut oils, but almonds and walnuts and chia seeds and flax seeds. Those are the best ones. Did you hear me? Almonds, walnuts, chia seeds, and flax seeds. Not peanuts, not peanut butter. Why? Because they're neurotoxic. They cause inflammatory reactions in the nervous system. But the almonds, the walnuts, the chia seeds, the flax, and so forth, these are excellent sources of fats and fiber, and they help drop the inflammatory levels down in your body. Olive oil, avocado oil, coconut oil, no other oils. Get rid of the seed oils. They cause all kinds of problems. These compounds, they mimic the effect of NSAIDs, non-steroidal anti-inflammatories. So they reduce pain. They reduce the stiffness. Obviously, those of you who heard me run my mouth for a long time know that I'm Sicilian. I'm first generation to this country. So olive oil in glass bottles, imported, that is highly, highly organic, is what I eat all the time, every day. I have at least a couple ounces, not a couple ounces, but at least an ounce and a half of olive oil every day in my diet. And then days I add the rest of the things I just told you about. Ginger is a very powerful anti-inflammatory. And then if you want something that'll break down residue, pineapple and bromelain, get yourself a proteolytic enzyme. What does that mean? Those are things that the pancreas produces, bromelain, amylases, and so forth. And you can take a couple of them on an empty stomach every morning before you put anything else in your body. It dramatically decreases the inflammatory effects that may have been accumulating over time. Does it do it in one shot? No. Onions and garlic, same thing. But remember, let's avoid things too, right? Processed foods of any kind. If it's in a box, it's probably not good for you. If it's in a bag, it's probably not good for you. Sugar beverages, particularly anything that has high levels of fructose in it. Either your artificial sugars, no, sorry, but high levels of sugar dramatically can aggravate, increase your inflammatory reaction and the pain in your back. Fatty red meats. Now, I'm a meat eater, but I'll eat free-range beef. It's usually a filet, low levels of fat. So, but particularly if you're sensitive to anything, don't get the garbage that's out there. That's, they're injecting our foods now with all kinds of things. Remember, they will not allow U.S. raised meats to go into Europe. The EU says, no, sorry, time out. We don't want you. So, but a diet that is rich in anti-inflammatory foods, right, are great for you. You can have red meat, but they need to be free range. They should be organic. They should be grass-fed. If you meet those criteria, you're good to go. All these guys that are out there eating, nothing but red meat, I think you got a problem coming up. My opinion, I've already started to see it. But remember, We want to add the right things to your system, and we want you to benefit from, a lifestyle that is promotional. So let's recap a little bit. Things like salmon and turmeric and olive oil and spinach and collards and endive and so forth. Blueberries, any of the berries. Blueberries are the best. They are the best. Green tea. Green tea is a powerful, powerful, anti-inflammatory. Brew it 3 to 5 minutes and then enjoy it. There's so many different types of green tea, but again, you want to get organic. Sweet potatoes, you got to have those carbs. Sweet potatoes. Carrots are great as well. Olive oils we've talked about. It's important that you take note of the things that will make a difference and help you. It's not something that you could be back. So we're coming up to a break. I got a whole lot more to tell you. Don't go away. You're listening to Dr. Tom Roselle. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. You're listening to Ageless Health with yours truly, Dr. Tom. Great program today, right? So much data. I could go on and on and on. Hey, listen, Northern Virginia, Pennsylvania, every place has had such a impact snowfall. Please be careful. When you're out there, bend your knees. Don't lift with your back. A lot of you are going to go out having done nothing for a long period of time. And that inflammation that you think can be kept under control with drugs and so forth is still there, not going to get you anything but trouble if you don't do it the right way. Make sure that you go inside, you rest, you stretch, go a little bit, one piece, don't do it all at one time. Better yet, go hire some kid and give them, $20 and say, hey, will you sweep off and shovel my sidewalk in front of my doorstep? The rest of it can wait. It's going to clean up. but please be careful. Anyway, let's get into the things I promised you. We did a lot today, right? We told you about, the things that will cause it, the sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, all the GMO products, the breads that you're eating that are going to affect your inflammatory reaction. You're going to have a problem, with that bag of chips that you have sitting next to the computer, that candy bar that you reach for, that cup of coffee with the sugar in it. Some of you just use coffee as a carrier process for about 4 teaspoons of sugar. Those are causing you problems, my friends. It's causing you all kinds of things. The numbness, the tingling that you have in your legs that is coming from your low back because you're developing spinal stenosis. Those are problematic. They're issues for you. So if you know those things to exist, give me 3 really good reasons why you're not willing to do something about it. I want you to join me on February the 18th with the professor, Dr. Harlan Browning, and we're going to get into low back pain and leg pain in depth, 6 p.m. at the Roselle Center in Fairfax, Virginia. Please join us. All you got to do is go to drtomroselle.com or rosellecare.com and register. Again, the only thing that we ask you for is to let us know if you can't make it, something comes up, and do it a day before so we can pick up the phone and call people and say, hey, we have an opening. Would you join us? So I promise you're going to go away with a ton of data. You got away with a ton of data today. If you just do the things I told you to do right now, just with this program, the water, eating all the vegetable sources that you should be eating things that are organic, getting rid of the chips and dip, those kind of things, just doing that and getting off your butt and going for a walk. Don't sit all day long in front of the stupid computer. It's important that you understand that. Your health is in your hands. Don't ignore it. Why are you putting things off? I don't understand. I really don't know. I'm at that place where I've been around the planet for a long time. Coming up April, I've been in practice 49 years, doing everything I can to help as many people as I possibly can. I'm still looking to figure out how to take the next step. I've seen all kinds of things reverse themselves over the years, especially back pain, especially leg pain. If that's the case, if I'm going to do it, why not you? Why can't you? If you're breathing, if you're listening to this program, you're taking in capacity to be able to listen to things, do something about it. Step up to the plate. I told you that if you stuck with me to the end of the program, that I would give you something, a water source, if you will, that would make a huge difference. And it's called hydrogen water. Everybody's heard about it. It's biohacking, but we've had it, in our practice for our staff. We've had it, for our patients for quite some time. If you go to drtomroselle.com and go to Ageless Health Store at the top of the toolbar, click it, you go down, scroll through the stuff, and you're going to see these filters. Some are portable. You can take it with you, you can keep filling it, take it with you. One's a house unit. You can put it on top of your sink, so you always have it available to you. But it'll dramatically decrease the inflammation. As a matter of fact, I'm going to give you a little heads up. Please go slowly with it. Don't sit there and drink 2 liters of it all day long and think that you're going to get sick, because it's going to pull the toxins, the inflammatory levels out of your body. Sip on it, go slowly. And as the days go on, it should be combined with dietary patterns as well. And you're going to find just doing something like that is going to give you energy that you had forgotten that you had. Get up and walk, start moving. Yeah, it hurts a little bit, but if you start taking control of your diet, guess what? It won't be such a problem. Ageless Health Store is there for you for all kinds of things. If we recommend something on the program, you're going to see it. It'll be there. Remember that we've opened up a portal that you can order virtually any kind of nutrient for, except the ones that we have to prescribe. And we'll do that if you're a patient of ours. That's a different situation. So go into that site, go into Ageless Health, and you're going to find both of those things there, Ageless Health Store, right? Either at rosellecare.com or in Dr. Tom Roselle Live. It's on both sites. And go into it and create an account for yourself. And if you're looking for, a magnesium and so forth, if you're not my patient, we trust this outlet. It has all the good quality supplementations in there. And, send me a note. And by the way, if you ever want to hear something on this program, send me a note. Go to drtomroselle.com and send me a note, and I'll respond to you. I promise you I will. Remember, I'm here ongoing to really give you all the data that you need to have to really turn your life around, to make life better. Why sit when life is meant for movement? Why sit and create nothing? Why sit and be paralyzed with fear? Why sit and have no creativity left? Because all you're doing at that point is you're waiting, for something to happen for you. You are where you are right now, and it's perfect. Why? Because you are. All the decisions that you've made up until now, and by the way, a lack of decision is a decision. The lack of moving forward is a decision. So if that's the case, maybe change your mind, right? Make a different decision. Do something differently. If you do one little thing differently, consistently, on a day-to-day basis, the outcome moving forward will be exponential. I'm still trying to figure out what I'm going to do with the next 50 years of my life. How about you? What are you going to do? You're going to sit there and say, well, I better go, get my will in order, and I better go to the undertaker and decide whether I'm going to be buried or if I'm going to be cremated. And so, I want to throw up when I hear that. That means you've given up. How about when you're young? And what's worse, when I have young people that come in their 40s and their 50s, and they're telling me that kind of silliness, I'm saying, why? I had a young man came in about 4 or 5 months ago, and he was about 43 years old, and he was feeling badly. He had headaches, and his energy was dropping and so forth. And I said, so, what's the deal? He says, well, I want to see if I can modify the problem. I said, okay, great. He said, I know I should expect it for my age. At your age, in your early 40s, just barely crossing over into that decade for your age. I don't know about you, but when I was at that age, you couldn't stop me. I was ongoing. It's attitude. That's the emotional side of the triangle. It will affect your back. If you have stinking thinking, you're never going to pull up for wherever you're at now. So let's change things. Let's make things different. Let's make a decision and move forward one step at a time. Keep listening to me every week. And I promise you, I'll give you data that you hadn't thought about. I'll continue to motivate you. Join us at our in-house programs. And at some point, we may have an all-day event like we used to have. We're actually thinking of bringing those back. So if you knew you could, would you? If you knew there was something better than where your headspace is, would you like to change it? Quit listening to all the stinking thinkers out there, all the talking heads, the political craziness. You don't need that. Unless you're willing to step up and go do something about it, meaning being proactive in a pro-life or something of that nature, why are you listening to that garbage? You can update yourself once a week, and that's all you need to know. But go get involved with you first. Get your health back. Do things that are important. Get a little exercise. Just walking and stretching and moving, but you got to do it every day. You got to do it ongoingly. It's not going to be done to you. Your health is a do-it-yourself program, period, end of story. And even when you buy into the nonsense, take this for that. Why? Is it fixing it, or you're on that drug for the rest of your life? Once you'd like to fix it, there's a whole program about epigenetics that I'll deliver to you one of these days. And that's how outside influences affect the expression of your genes and your body's ability to resolve and change anything. But for right now, if you did nothing more than make a decision that you're going to get rid of a lot of the garbage that's affecting your intestinal tract, wouldn't it be nice to have your low back pain be gone, modified, so you can start doing things and enjoying your life again? Wouldn't it be cool? Not surgery, not injections in your spine, but changing it with your diet, changing with the consumption of the things that you put in your system. I love doing programs like this because it really is one of those things that you can change, right? Health is a do-it-yourself program. Go to drtomroselle.com, check out that hydrogen water filter, check out those 4 supplements that I told you about last week that will keep your immune system nice and strong. There's a bug out there, my friends. There's actually 4 of them. But I want you not to be the recipient of that viral pattern that's there. I want to keep you well. There's so much more that you can do. You're listening to Dr. Tom Roselle as you do on an ongoing basis every week. And I'm here for one reason only. Look, you deserve the data. You are your control mechanism, nobody else. And simply this, and I say it sincerely from my heart. I love you all. Have a great day. Bye.